Hi, I'm Dr. Eli Whitney of the Heart and Vascular Institute of Texas. I'm going to talk about the blood test called CRP for C-reactive protein. Atherosclerosis is a gradual buildup of plaque in the walls of the arteries that feed the various organs of the body, especially the brain and heart. When the plaques become large enough, they can decrease the amount of blood flow to the various parts of the body. The first step in plaque formation is when cholesterol is added to the wall of the artery just beneath the inner skin of the artery. When enough cholesterol is added, white blood cells, the same cells which fight off infections, and smooth muscle cells move into the walls of the arteries and stimulate the formation of fibrous material. This fibrous material is similar to gristle in a steak. The fibrous material separates free cholesterol, white blood cells, and smooth muscle cells from the inner skin of the artery and the blood on the other side of the skin. If blood were to come into contact with the free cholesterol in the plaque, a blood clot would form immediately. This blood clot could cause the artery to be totally blocked. Of course, if this blockage were in the heart, the result would be a heart attack. Hence, this fibrous material that forms in the artery wall is really protective. As you know, over 90% of all strokes and heart attacks are caused by the sudden formation of a blood clot at the site of a plaque buildup, producing total blockage of the artery. When white blood cells in the plaque become overactive, they release chemicals that dissolve the fibrous material that separates the free cholesterol in the plaque from the inner skin of the artery wall. If this occurs, it's very easy for physical motion of blood pressure and blood to break the skin of the artery and allow blood to come into contact with the free cholesterol and cause the formation of a clot. This excess activity of white blood cells is what we call inflammation. A simple blood test called CRP, or C-reactive protein, provides a measure of overall inflammation in the body. In the Air Force Coronary Atherosclerosis Prevention Study, or AFCAP study, blood was saved in all participants. At the end of the study, I, along with other investigators of the study, allowed the blood samples to be sent to a scientist in Boston. He looked at CRP levels in those who had heart attacks and compared them to those with identical cholesterol and HDL levels who did not have heart attacks. What he found is that for the same cholesterol levels, those with the higher CRP levels were much more likely to have a heart attack. A person with a CRP level between 4 and 10 is 4 times more likely to have a heart attack than a person with a CRP less than 1. In the recently published Prove It study, a large group of patients with heart disease were given either pravastatin or atorvastatin. The group which received atorvastatin had a much greater reduction in CRP and LDL cholesterol than the group that received pravastatin. They were also much less likely to have a heart attack in the next 3 years. We now realize that many of the things that reduce the risk of having a heart attack also reduce CRP. For example, exercise, cholesterol-lowering medications, proper diet, medications which treat high blood pressure, and diabetes all reduce CRP as well as the risk of having a heart attack. Unfortunately, the relationship between change in cholesterol level and change in CRP is not perfect. That is, there are some people who have a large drop in cholesterol but only a small drop in CRP, and vice versa. However, the greatest reduction in risk comes with having a low LDL cholesterol level and a low CRP. For this reason, I think it's important to measure CRP in all patients with known cardiovascular disease and in those who are at high risk for having cardiovascular disease. If your standard risk factors such as cholesterol, blood pressure, smoking status, and diabetes are well controlled, and your CRP is high, it is imperative to further reduce the risk factors as well as improve diet and exercise. If you have a family history of cardiovascular disease and your cholesterol levels do not look that bad, I would recommend cholesterol-lowering medications if your CRP is high. If your CRP is low, then I would not necessarily recommend drug therapy. What are the downsides to the CRP test? First, not all people with a high CRP test have active cholesterol blockages in the arteries feeding the heart. CRP increases whenever a person has inflammation from any source. If a person gets pneumonia or has severe bronchitis, the CRP test will increase for a while before returning to normal. If a person has active inflammation of the joints from diseases such as gout or rheumatoid arthritis, the CRP test will increase. If a person has an infected prostate, colon, or other important body organ, the CRP test will also increase. However, if a person has overall excellent health and no active cholesterol blockages in the arteries feeding the body, the CRP test will be low. The cost of the CRP test in our lab is $18. I strongly encourage you to have this test performed on a periodic basis if you have known cardiovascular disease or are at high risk for developing cardiovascular disease. It will help me tell if I have you adequately treated. I hope this educational video has helped you understand CRP and why it is important to your health. I'm Dr. Eli Whitney with the Heart and Vascular Institute of Texas.